Welcome to my channel RX Sam 2020. Today we discuss an ear drop named SOLIWAX. Medical use. Treatment of softening of earwax. SOLIWAX ear drop is a medicine used to treat pain in the ear. It helps in dissolving the earwax. This way it relieves pain caused by hardened wax inside the ear. What is earwax? The ear canal has glands that produce cerumen, waxy oil. Wax can accumulate and block the ear canal. Earwax generally traps and prevents dust, bacteria, other germs and small objects from entering and damaging the ear. But in some people, glands produce more wax than usual and may harden and block the ear canal, resulting in wax impactions, build-up of layers of earwax and blockage of the ear canal. Symptoms. The symptoms of earwax include ear pain, decreased hearing, ringing in the ear, dizziness, fullness or plugged sensation. Earwax can be removed by using gentle suction, a curette, a small plastic spoon, or irrigating the ear with sodium bicarbonate, warm water or certain ear drops. Contra-indications. Hypersensitivity or allergy to benzocaine, chlorbutyl, paradichlorobenzene, turpentine oil, or any of the ingredients of SOLIWAX ear drops. Should not use this drop for a prolonged duration or more than the prescribed duration. Eyes come in contact with SOLIWAX ear drops. Rinse eyes with clean water immediately. Special precautions. Hearing problems, kidney or intestinal problems, Parkinson's disease or myasthenia gravis, muscle weakness. SOLIWAX ear drops should be used during pregnancy and breastfeeding only under medical advice, as there is limited safety information available in pregnant and breastfeeding women. Drug interactions. No interactions were found. Side effects. Insomnia, difficulty in sleeping. Application site reactions. Headache. Dosage. Directions for use. SOLIWAX ear drops are for external use only. Lie down with the affected ear facing upwards. Hold the dropper over the ear and instill the advised number of drops into the ear. Replace the outer cap after use. Do not touch the tip of the container to the ear or surrounding areas, as it may contaminate SOLIWAX ear drops. Put SOLIWAX ear drops, 3 drops 3 times a day for 5 days. Mostly it will liquefy earwax and you will get relief. If it will not come after 5 days, better to visit an ENT, ear, nose and throat specialist who will clean your ear without damaging it. Advice. Avoid the removal of earwax with objects, as it may worsen the condition. Limit cleaning to the outer ear only. Avoid frequent use of earphones, as it may also cause wax buildup. How does SOLIWAX work? SOLIWAX ear drops is a combination of 5 drugs, namely benzocaine, BHA, butylated hydroxyniazole, chlorbutyl, paradichlorobenzene and turpentine oil. Benzocaine is a local anesthetic that blocks pain signals from nerves to the brain and reduces the sensation of pain. Chlorbutyl and BHA act as preservatives. Paradichlorobenzene is an earwax softener that decreases the thickness of earwax. Turpentine oil acts as a lubricating agent. Thank you for watching. Please like and subscribe to my channel and click the bell icon to get video updates.